So have you all been like, I'm sure you've been monitoring the whole situation with COVID-19, but when did it start becoming a kind of, I guess for lack of a better term, an issue for the county in terms of whether or not we had it or preparing for the possibility that it could show itself here?
Yeah, so it all seems like one big mushy mess at this point.
Right.
I think we started talking about it middle of January.
We did.
Like it got on our radar pretty early before it was even being discussed really regularly in the States, like when it was still just...
The first thing I learned about it was actually an email from you, because you'd seen the bulletin.
Email from Kymmie?
From Kymmie.
Yeah.
And my reply was, sounds like SARS, better watch this one, or something to that effect.
Yeah.
And that was like maybe late December or January.
Yeah.
So everyone's been aware of it. Everyone in public health around the world has been aware of it for quite a while, ever since the outbreak started. And everyone's been watching.
Right.
You really start paying a lot of attention when you see it start to move out of the original place. So once it started showing up elsewhere in China, especially when it expanded so much in Hubei province, I think everybody around the world was starting to get a little concerned. Because that's the nature of a transmissible disease. It's just going to start expanding.
So you mentioned SARS. Was that, I wasn't here obviously, but did that cause a big concern for Del Norte County?
SARS, the original SARS outbreak in 2003?
Yeah, in 2000.
No, I was health officer back then, and I was following everything that was developing, but I never had a real concern that it was going to end up here. It just wasn't behaving in a way that made me think it was likely to jump ship, so to speak, and get out into the communities. It was, a pretty well contained outbreak to only a few locations, so that was a different story.
Okay.
And probably has to do with the nature of that particular virus, which was also a coronavirus.
So you guys have been tracking this since earlier this year, December, January. When did you all prepare for the possibility that it could show up here?
So I think we started having weekly meetings with OA partners at the beginning of February.
That sounds about
Like
right.
about the first week of February, we started just offering a meeting up to our local partners to talk about it and start thinking about what sort of resource needs we might have if it were to come this direction.
And who would have been in those meetings? Just department heads?
No, so we work with a wide variety of agencies across Del Norte. So for OA meetings, we invite everybody. So we invite sheriff, police department, fire department,
Park
school
service.
district.
Tribes, park service,
Yeah.
nursing homes, people who are likely to have a real interest in what's going to happen when it first arrives.
What
So
does
the
OA stand for?
Operational area.
Thanks.
And so for the first few meetings, it was primarily healthcare service folks, healthcare providers who attended. And at the last meeting, between people we had in person and people that attended on the phone, we were pushing 70 people
When was the last meeting held?
last Friday.
Okay.
Can you characterize at all difference between initial meetings and the kinds of information that or maybe just scenarios that you ballparked, and how it's actually shaken out then?
I think a lot of the early meetings, I was there to answer questions about what was known at the time and give my best estimate as a medical professional about what we could expect. And, there wasn't a whole lot that I could say with certainty, but everything that I said back then I think is still holding true today.
Yeah.
Because what we were expecting pretty much started to take place. It was transmissible. It was moving out of the confined areas that it started in. And I think the interest at the table was, what are we supposed to expect when it gets here? I think people were forward-looking even back then, that the likelihood was that it was going to arrive in the United States and become a problem everywhere in the country.
And so those meetings are good, not just to like give information out,
Mhm.
but it's a good place for us to get information back as far as what plans people have in place, what they're reviewing them, what sort of like PPE supplies they have, all of those sort of things, so that we can start thinking about what resources we might need moving forward, so that we could be proactive with that.
Did you identify anything that you needed to change or address?
So I mean, I think from the get-go, PPE has been a thing.
PP?
Personal protective equipment.
Okay.
And so because this is a worldwide event, it's something that everybody needs. And so where people may have been more free in their use of PPE in the past, like we're really talking to folks about how to be smart in their use. And then there's the opportunity for people who may not normally use it in their jobs, where they may have opportunities, isn't maybe the right word, may have situations where they would use it. And so we've done PPE refresher training with everybody. And
this is to protect responders for in any of these situations. Anybody
responders and healthcare workers.
Exactly.
And when you say PPE, masks and gloves, and maybe goggles or something.
And gowns, sometimes.
And, I'm sorry?
Gowns.
Gowns.
You've seen pictures, I'm sure, of people wheeling gurneys back and forth.
Right.
And they're all gowned up, and that's what we're talking
Right, or if you're watching, if you're watching Outbreak, they're like in full-on
The
suits.
hazmat suits and things.
Yeah.
Right?
Yeah. So in Del Norte County, how many suspected cases of COVID-19 have there been so far, and how many? And do we have any actual
5 as of today.
5 suspected cases?
All have been negative. Well, 3 have come back negative. We have 2 waiting.
Okay.
Now, I'm sorry, I interrupted.
3 negative results so far, 2 that are still pending. I don't have a high clinical suspicion that either of those will turn out positive. Part of this is kind of hard to explain how we think about this, but when I'm looking around the country at other places, what I'm seeing is hotspots showing up. Small outbreaks that are starting in definite locations.
Seattle.
With Seattle, yeah. And then there's that undercurrent of transmission that we don't know about yet. And that's what everyone's worried about, is the unknown transmission that could be going on as a consequence of those outbreaks that may or may not have been identified very quickly. So that's what everyone's afraid of.
Okay.
And that's going to take another week or 2 to start emerging, because this virus doesn't behave like a measles virus where you walk in the room and cough and sneeze and everybody in there is going to be infected within 10 minutes. This is a transmissible virus, and it's more easier to transmit than flu, but not a lot easier. It's more like a medium range kind of transmission. And it's going to take some time when it gets to communities to actually penetrate out into the communities. So that's why the value of having testing available and doing testing early makes a lot of sense. I'm not discouraging any offices to not test at all. I actually want them to. I just didn't want them to overload the system with test requests. Mm-hmm. And so far they haven't. Commercial tests have been available this week. And we've only had a few tests that we know of that have been processed on a clinical ground. So I think they're using good judgment. They're getting used to the new system, the new availability of the test. But that's how we're going to find it when it gets here. It's going to turn up in a case in someone's office or the emergency room or the hospital. That's how we'll know.
What is the test like? I mean, is it a blood test? Is it what goes into the testing?
The test uses what's called polymerase chain reaction technology.
Okay.
And what that is, it's a way of amplifying genetic material. So you can take trace amounts from a sample, run it through this processing system, and you can get identifiable genetic material that turns the test positive. And so it's done on swab samples from the nose and from the throat. It can be done on sputum samples. It's done for a lot of other things in a lot of other areas like forensics and things like that. But medically, right now they're only focusing on swabs. To a lesser extent on sputum, but mostly swabs. And it takes some time to process. they're at most of the labs they're doing it in batches, and they'll run a bunch together, and it'll take several hours for the whole process to get through and then get reported out. So it's not like you can go in and have your swab taken at the nose and pop back into your room at your doctor's office and wait 10 minutes and get an answer. It doesn't work that way at all.
Okay.
So so there are genetic markers that they're looking for. They're looking for actual like genetic evidence of the coronavirus of COVID-19.
Yes.
Yeah. Okay.
And the people that are being tested, did they suspect that they may have COVID-19? Did their medical professional suspect they may have it? Did they show certain symptoms? And if so, what were they?
As a group, I think all of the cases that I was presented, and basically I heard about all of them, they all had similar symptoms that would be consistent or potentially consistent with COVID-19. The trouble with COVID-19 is it's not very specific. It's a typical kind of flu-like illness is what we call it. The symptoms can cross a lot of borders depending on who's involved. There are only a couple of symptoms that seem to be the hallmark symptoms, and those are cough and fever. But even those aren't universal. There are some cases that showed up in hospitals in China that they hadn't mounted a fever yet. So it's kind of vague. So potentially just about anyone who comes in with flu-like illness could get tested. And once you're taking away the requirement of travel and contacts with known cases, and you're trying to test for community spread, that means pretty much anybody who thinks they have a cold or a flu and are worried. Now we're trying to discourage unnecessary testing. For a young, healthy person, it's kind of irrelevant whether you know, unless your job is such that it really is important that you know so you can return to work and know that you're immune. Mm-hmm. So you're a nurse at the hospital, for example.
So that you know that you won't spread it to others.
Exactly. Or you won't get it again. And you'll be able to work in an environment, free from worry.
Or if you have somebody at home that's in at-risk category.
Mm-hmm. That's another important category, yeah. Someone who's elderly or frail, has a lot of chronic illness, and they would not do well if they got the infection. It's important to know for those people because it kind of sharpens your focus on what you're going to do at home to protect them. Now, having said that, while you're waiting for the test, which could take a couple days, you still need to do those things. But if the test result came back positive, I think people would really be very careful. And there's some value to that.
You mentioned immunity. Is it like the measles, or once you have it, are you immune from getting it again? Is that how does it work that way, or do you guys not really know yet because it's so new?
We don't know for sure.
Don't know for sure.
We think, based on what's happened so far, that immunity is likely. And we think because it's part of this coronavirus family where people do develop immunity to the infection, or at least partial immunity, that it probably is carried over, at least for a while. So at least for the duration of the outbreak, if you got the infection and you recovered, we think it's very likely that you'd be protected for at least the next few months. But nobody knows for sure. And I'm saying that emphatically because I have not heard anything from anyone at any level of the public health system that's definitive about that. But it's a reasonable conclusion given what we know about this family of viruses.
So at this point, to your knowledge, there are 2 cases pending, 3 that have been negative. The virus has not, as of this point, made itself or shown itself in Del Norte County.
That is correct.
Okay.
These 5 cases that you talked, is that since the first one last week? That was the first one I was aware of.
It includes the first one.
It includes the first one. Okay.
Okay.
So I think it's important for everybody to know how much behind the scenes collaboration there is, not just within the agencies in Del Norte, but we are on regular calls daily with California Department of Public Health, with California Office of Emergency Services, with CDC. So we've been working closely with all those partners, and then also with our nearby, we're in constant communication with Humboldt County, Curry County, and just maintaining those contacts here too, so we all kind of know what each other's doing.
It's kind of important to keep the whole paradigm as part of the picture. when it's a global outbreak like this and it hits a country, whatever country's national public health service is available takes over, and that's for us, the CDC.
Mm-hmm.
So the CDC has set all the guidelines that we're following, all the recommendations that people are trying to enact. The state health departments are pretty much following the CDC's lead, and we are following the state health department's lead as almost to a letter as much as we can. There is always a little flexibility in local health departments because they want you to keep that in mind because every local jurisdiction is different. You know, there's Los Angeles County versus Alpine County.
Right.
Huge differences.
Right.
But in general, it's a national, and as of today, because the World Health Organization declared a global pandemic, it's a global project to try and combat this virus. We're all kind of part of that same system. So we have been going back and forth and listening in on conference call, trying to stay updated. I probably listen on at least 4 or 5 calls a week, average about 1 a day. Had one last night till about 7:30 in the evening. I've had a couple on weekends.
Sure.
I mean, it's been a busy time for us.
So the part of the WHO's, the World Health Organization's designation of this being a pandemic now is a criticism as to how countries around the world had sort of dragged their feet, have not addressed this issue. What's your sense of upstream from you guys, of the information you're getting from the CDC, from State Department of Health? Are you getting the help? Are they working? Is the system working, or are there things that you would like to see differently handled?
I think for the most part, I've been pretty happy with what the CDC's produced.
Mm-hmm.
I speak as 10% health officer, 90% clinician, because I've been a physician in this county for 28 years almost. So I think more of a clinician's point of view, and I think that I would have liked to have seen a little more messaging about the stage we're in now a little bit earlier.
Okay.
About mitigation, about things people should do and start ramping up the whole flu rules business and what people need to do on their own to try and protect themselves and protect the people around them. But the message that is coming down now, I think, is excellent, and I'm happy that they're doing that. I think they were following their own algorithm about how this goes, and there are certain steps you have to follow in doing this, and experience has shown that if you don't follow those steps, you get off on the wrong track, you can get everybody in trouble. So for the most part, I'm very happy with what they've done.
My frustration has just been testing was slow, and
The availability of the testing, or
yeah,
the will behind to test, or
we'll leave it at availability and
Okay.
whatever the cause was behind that. It would have been easier, I think, to sort of slow things down potentially if there was better information on that. And then to sort of underscore what Dr. Rehwaldt said, yeah, like the messaging's good. The slow part at the beginning was like having the nice sort of like easy things to share on social media. So like we were getting a lot of print guidance, which then you have to like go and create your own sort of like easy to digest bullet points and infographics. But that's really caught up here in the last few days, especially. Like there's a lot of really good, easy to spread information.
Yeah.
So,
Yeah.
Okay.
and that way I think that
Spread
helps.
in a good way.
Yeah, I mean that helps get good information out there because you guys are aware there's just so much misinformation being spread, and people with entirely goodwill about it are spreading misinformation because they don't know.
And I was going to ask you about that too, because COVID-19, it was a topic of discussion at yesterday's Board of Supervisors meeting. Roger Gitlin, in his board report, compared it with the flu and said people should keep things in perspective and made it sound like the flu is much worse. And I mean,
So I've
is
been
that
telling-
fair?
I've been... See, how do I want to phrase this delicately? Been
Sure, I
telling
get it.
people that they should be going to their reputable public health and OES resources to get good information. We don't lean left, we don't lean right, we lean forward, right? So
I'm gonna quote you on that. But is Is comparing the statistics and the rate of mortality, the rate of spread with the flu, is that a fair comparison?
Well,
It has characteristics of transmissibility like the flu.
Yeah, it is and it isn't, because the transmission route is probably the same,
Okay.
and the populations at risk are very, very similar. So flu deaths in this country, if you're a healthy individual, your chance of dying is a fraction of percent.
Right.
Like I said in my news bulletin.
Right.
It's very small. If you're over 65, it's 10 times higher, approximately, 5 to 10 times higher.
But it's still a fraction at that point.
But still like a tenth of a percent.
Right.
But the reported death rate for this virus is anywhere from 1 to 3.5%. And like I pointed out in some of the news bulletins to the public, we're hoping that that number is in error because they're not capturing everybody who's been infected.
Right.
They're only testing the people who get very sick or who are contacts of people who've been sick. And in a place like Wuhan and the surrounding province, who knows how many people really got infected.
Right.
So we're hoping that that number is actually lower. But even if it were the same as flu, it would still not really be relevant, because the difference is that in this country, maybe 50 million people get flu each year, but there's 330 plus million people in the country. This virus could potentially infect everybody in the country because nobody's had immunity to it, nobody's had a vaccine to it. So it's not the death rate that's the problem so much, it's the volume of patients that it could create all at the same time. That's the heart of the matter. And that's the important thing that we're trying to overcome. And the only way that we know how to do that is to really get the public aware of the things they need to do to slow it down. Because if they can slow transmission, even just cut off 1 or 2 people in their surrounding family unit or their workplace, it's going to have, and everybody's doing that, it's going to have the effect of slowing the virus as it goes through the community. And it allows the clinical care workers to take care of the people as they get sick, instead of being overwhelmed.
Do you want to hit those, just to get it out loud again, how to slow the spread?
Cover your cough, cover your sneeze, cough into your elbow, cough into a tissue, throw the tissue away so no one has to pick it up. Wash your hands thoroughly, lots of times, many times in the day.
Stop shaking hands. Stay
Which
home
is-
when you're sick.
Which is exactly what we did going into
And then
this.
we all used hand sanitizer.
Yeah, we did.
Dr. Rehwaldt walks up with his hand extended. I'm like, really?
It's hard. It's hard to break habits of a lifetime.
I'm not going to break habits of a lifetime. If it means, I don't want to get sick. I don't want to get other people sick. And maybe I shouldn't even be saying this because I'm supposed to be the impartial reporter. But if it makes somebody more comfortable to bump elbows with me or whatever, I'll do it. But I'm not gonna. I don't feel like. I don't know.
I stopped hugging my friends.
Really?
Yeah. I hug my kid. He gets 3 times the hugs now.
That's cool. I'll hug my cat, but that sucks.
It does suck, but I mean, besides the slow rate of transmission through the community for the healthcare workers, the other place where we want slow transmission is essential services, right? And so like everybody that helps deliver your gas, right? That keeps the water on, that keeps the sewage flowing, that everybody that provides all of those critical services, we don't want a large portion of them out at any given time either, because that affects everything.
Absolutely.
And
I don't want to ask you to predict the future, and certainly no one is going to conjecture, but are there contingencies that you're preparing for that
Worst case.
Our
Our job is.
I don't want to even get into like, oh, tell us your worst case scenario, because
We're not going to tell you what it is,
yeah,
but
exactly.
but are we planning for it? That's
Yeah.
our job.
Yeah.
Right?
Is there a
Exactly.
protocol in place for
Yeah.
things like closing schools or, for an outbreak? Are there protocols in place, and what triggers that?
CDPH handed out some guidelines last weekend actually, about school closures and mass gatherings.
Oh, wow.
So we have expert recommendation from the state level. I think they tied most of their recommendations to what the CDC was recommending.
Okay.
All these things are subject to change. That's the reality of this is our guidelines that we handed out 3 weeks ago, some of them are already out of date. Some of them from last week are out of date. Last night, the CDC revised some of the personal protective equipment that healthcare workers have to wear. Now, if they're in an environment where they think community spread is happening in their hospitals and their locations, they're saying you don't have to use these ultra strict isolation and personal protective measures that we outlined a month ago when we put the travel ban in place. That's basically what they're backing away from that and saying, you know what, it's a community-wide problem now, treat it as a community-wide problem, which is huge. It's huge for a community like this when it's hard to get personal protective equipment because the supply chain is based in China and factories aren't working there. And everybody around the country has the same issue at the same time.
So we were just talking about a shortage in toilet paper. I mean, is there a shortage? What is there a shortage of, and how does that affect us? Because we're so isolated and rural, and you have to truck everything like that basically in here.
Well, aside from what we've mentioned, I think the shortage that everybody is going to feel is medical professionals. You know, a lot of hospitals use temporary nursing to fill out their staff requirements. And they've kind of come to that because census goes up and goes down. Sometimes they need a lot, sometimes they need hardly anybody. But that system is applied to everybody at the same time, and if everybody has the same demand at the same time, it doesn't work very well.
Yeah. So yeah, like in emergency management, so that's what makes this one kind of different. Is usually like wherever there's a disaster, you have a fire, you have an earthquake, you have a tsunami. When your system's overrun, you go to your region to ask for requests, whether that's personnel, equipment, or supplies. If they don't have it, then you go to the state. If they don't have it, you go to the nation, right? And if everybody's dealing with the same thing at the same time, it's making the best use of what you have in your lap.
Wow. So you has there ever been a situation like this locally? You know, H1N1, for example, or SARS, you said, wasn't really a concern either.
This is probably the outbreak that everyone's been planning for the last 30 or 40 years,
Wow.
quite honestly.
When you say everyone around
Everyone.
on a national scale, global scale.
Yeah.
Yeah.
The heart of it has been preparing for the next big flu pandemic, and I'm sure you've read about those or heard about them.
Yeah.
This is not a flu pandemic, but it's so much like it. Effectively, it fits that mold almost perfectly. So this is the pandemic that people have been preparing for. I can't describe it really any other way. How bad it's going to be yet, we won't know till we're there, till it's actually here in the communities. But we're gonna get some information about that from other communities that are being hit already before it arrives. So that will help us a little bit. But the same situation is going to exist by the time it gets here as that it'll be everywhere else as well.
So what have you learned from other communities that have already seen the virus? Humboldt County, for example, or the Bay Area maybe, or Seattle.
So my mentors are up in the Seattle area. They're emergency managers up there. And so I've had some discussions with them this week, and their advice has basically been like the modeling looks pretty good for numbers, and so it's a good place to plan from is the information we've been receiving.
The modeling looks pretty good for numbers. What do you mean?
Just as far as like infection rates versus like you probably heard that 80% of people like will have mild to no, like so those kind of rates that you're seeing out there seem to be holding pretty true.
That those numbers are coming from Seattle?
Yeah.
Is that what you're saying?
So the numbers that they're seeing up there on the ground are similar.
Are holding out.
And so that doesn't necessarily mean that that'll be the same here because every community is so different. But from what they're telling me is that's a good place to plan from.
Those are probably armchair analysis.
I was going to ask you about that.
Because the data isn't in yet.
Okay.
Yeah.
It's so new to the country that we're just starting to collect this information. And they will get it out to us as soon as they can, because they want to let people know if there's anything significantly different from the experience in other countries.
Right.
That's got to be so frustrating for the both of you, as just to be. I mean, I understand the challenge. I understand this is what you train for. This is what you work for. But just to not have the answers that you need to make the decisions you need to make, not to have those readily available yet.
It's a lot different than planning for a tsunami, where you kind of have a line to draw around it, and you've been through
Right.
it before. And
So how is this affecting? I noticed that Safety Week has been pushed back to May. Is that or
so we're still gonna do Tsunami Education Week.
okay?
So there will still be we're still planning on the live code test on the 25th. And we'll still be putting out a lot of information over that week on
Excellent.
the normal stuff that we do for tsunamis. The preparedness fair is pushed back, and right now I just put a May date on it because Facebook made me put some sort of a date on it.
Yeah, I
and
hate
we
that.
don't. Yeah, we don't know how long this is gonna last. So I just thought it was not a good idea to be telling people that they should be doing community social distancing and then tell them to come together.
Come to this big fair.
And also on the flip side of that is everybody who's been involved in planning that is busy
Right.
and getting busier.
Right.
And so there's just not the bandwidth.
So there are a few events coming up. I mean, for community events, you mentioned social distancing. Should people cancel their, for example, the polka party at the harbor, or the corned beef cabbage dinner at St. Joe's, or should we be canceling these community events, JC's?
I'm thinking of all these things, like the Sneeze in Your Face Festival. Yeah, we'll cancel that one. But the thing. I'm sorry.
Well, I mean,
No, it's a great question. I'm going. I've got a daughter graduating from college in May back east, and I got to cross the country and go stand in a huge crowd on the East Coast. Is that even going to happen? I mean, I know it's too soon to think.
I'm
that.
wondering about the Olympics too. I mean, what is that going to do to?
There's a lot of things that are canceled. I'm starting to see more and more, especially at the state level, a whole lot of our meetings are moving to virtual meetings, or they're being postponed if they're not essential.
The South by Southwest was canceled in Austin. Yeah.
I think Coachella's either
Coachella's
been
getting postponed till the fall sometime.
Is there a progression in your plans, as things worsen in Delaware County with infection rates, that sort of trigger downstream, decisions, especially from your office, about, at what point?
Those are his office decisions.
Okay, well,
Wait,
that's probably
Cal,
goes together because he's got to make it, but you would have to execute it. But if is there a percentage of infection rates that would trigger a specific action from your office as far as
telling people
closing
they should.
schools or distancing or not having board of supervisors meetings or
Please.
So no, I'm sorry. What would trigger those things? Or do you have that rubric in place at this point? Like if it proceeds to this point, this will happen.
Well, there's been a lot of discussion about this because the data to support closing things like that is not very good. It's not very good data, and it's not convincing one way or the other.
You tell people not to go someplace and they just go somewhere else.
I think a
Right.
lot of places have started initiating closing because of pressure from different directions that are kind of forcing the issue. I've talked with the school districts, talked with Jeff Harris a couple times already about this, and I'm not really in favor of closing schools because I don't think that it really solves the problem, and it really puts a lot of students and families in distress. Because you have to.
That's a drastic step. Closing schools.
You have to stay home to take care of your children. School lunch programs. How does that get administered?
Right.
I want them to focus more on the people within those groups that are at risk. So for me, that would be families that have vulnerable elderly people or vulnerable immune compromised people in the home. And also some of the teachers, especially ones who are getting close to retirement, whose health may not be so good. Figuring out ways to protect them and keep them sequestered, so to speak, from the virus as it goes through the community and maybe goes through the schools. Because we're not really worried about the kids and what's going to happen to them. Most of them are going to shrug it off just fine. Some of them will never know they even had it. And closing the schools has not been shown always to really prevent that process. It may slow it down one notch, but kids are going to go hang out with other kids, whether they're in school or not.
Right.
It seems like
That's been the experience.
At a certain point, even just having schools open and having the kids there gives you a great opportunity to interact with them, to know who's ill in the community, and to get them even the care that they would need.
Yes, it's a teaching opportunity just to see it happening and reinforcing the messages for kids. Because it hasn't really sunk in yet. We've been messaging for a while now, but we know that, well, I shook both your hands.
Yeah.
We know that it's not in there yet.
Right.
So we got to keep working at it. As for mass gatherings, same thing. I mean, there was some question about whether the JC's tournament should have gone on last weekend. I told them I didn't have proof that there was anything going on here.
Right.
Some people were saying, well, maybe they're going to bring it here. And I said, well, yeah, that may take place, but it's going to end up here anyway.
Right.
It's the difference between 1 week and 3 weeks or 4 weeks is not
And
a huge difference.
And so, by that same token, travel. Is it safe for people to travel? Or
Very good question.
yeah,
Some people are changing travel plans just because they don't know where it's going to be when they land.
sure.
You probably heard Dr. Fauci talk about no cruise ships for elderly people yesterday.
Oh wow. Okay, that I didn't realize that, but okay.
Oh yeah, that was, it's out there.
It's changing so fast.
I wouldn't go on a cruise ship anyway, but that's
Right.
But I mean, but not all, what?
Sorry, no, just that. So will coronavirus make cruises cool again? Is that what's going to happen?
Who wants to go on a cruise ship?
Let's go on a cruise ship with a bunch of old people, is what I'm saying. Never mind.
Well, okay, the reason I ask that too is, and I don't want to friggin' cite her, but I'm going to do it. Linda Sutter making a big deal about the high school kids going to Japan. Like, is that a valid concern?
No, I don't think so.
Okay.
I looked over, I talked that over with the superintendent too. We talked about the dates of travel and their itinerary and where they went, and really wasn't anywhere close to where the outbreak was in Japan.
Okay.
So,
And they were provided additional training before they even went.
oh yeah,
On
they got trained up.
masking. Yeah, so yeah, they got put together with nursing staff to learn about how to properly mask, how to wash their hands, how to sanitize things. Like, they were more educated than the rest of this community at that point.
And the very fact that they've been back so long and we still don't have any proven cases here points away from
Yeah. What is
that.
what is the incubation period? Is there an incubation period?
2 to 12 days.
Okay.
Probably averages about 4 to 7, somewhere in that range. Kymmie and I disagree about this because she keeps hearing all these
There's
reports like
outliers.
42 days. And
Well, I've heard that too, and that's why I'm asking. 30 days is what I've heard, or you know, and that sounds like an outlier too. I don't know.
in general, I think those numbers are probably outliers
Okay.
and probably not genuine. You know, they're probably somebody who got exposed and they didn't know really when they got exposed. They're just giving their best guess.
Okay.
There's one thing I want to make clear though, because I know you were taking notes about it.
Yeah.
So when I mentioned earlier about, you know, the whole country being susceptible to this, technically that's true.
Right.
But realistically, a virus doesn't move through the community and affect everybody the first time around. Usually there's a tipping point where enough people have been infected that it slows the transmission down to the point where it starts to die off.
Mm.
So we don't really know what that is.
Okay.
50 to 60%, maybe that's what we've been seeing
that's
online.
kind of what most people seem to agree on.
The experts are saying probably that amount of people to get infected before it really halts for that particular round. So that's still a huge number though,
Right.
for the country. So I think we should expect, and it's going to take a while for all that to happen. This virus is going to be with us for quite a while. And it may become a human pathogen ongoing for the rest of
Forever.
Like
forever.
the flu.
Yeah.
Yeah.
Or like the other 4 coronaviruses that are known
The
human
common
pathogens
cold,
that cause colds
Right.
routinely. Yeah.
Excellent. Do you have?
No. Mm-mm. Well, thoughts to leave listeners or readers with. What is a good takeaway for folks to come away from?
Don't panic. Stay home when you're sick. Keep yourself isolated if there's people in your house who you think are at risk of having a bad outcome. And that means elderly, people with bad chronic illness, and people whose immune system doesn't work for whatever reason.
Being neighborly. If you have a neighbor who's one of those at-risk groups who needs to stay home, when you go get groceries, offer to help.
Help people form lifelines, be a lifeline for someone, and get a few others on your side too in case you need help. But the key thing is staying home. And I mean staying home until you're completely better. The guidelines usually talk about no fever for at least 24 hours. And is it 24 or 48? I think it's 24.
It depends on where you look.
And that is not using any ibuprofen or Tylenol or anything to control fever. And I think people should wait a little bit longer if they can. The longer the better. So in our messages, we've just been saying wait until you are completely better before you go back. And the trouble is you can't tell the difference between this and any other kind of flu-like illness. So we're asking people to start now, treat everything the same. Even though we don't think it's here yet, start getting in the habit of doing that. Because when it gets here, that's when that habit really pays off.
Yeah, and we won't know that it's here the second it walks across the
Right.
county line,
Yeah.
right? So,
Gonna be a little bug. La 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 la.
I saw an analogy somewhere else, and he's heard me say this before, that I like is like a star. So when you see the star in the sky, you're not seeing that real time,
Right,
right?
that's it.
Right,
So-
you're seeing it in like hundreds of years ago, or maybe even thousands of years
Right, it's
ago.
kind of like
Yeah.
looking back in time. So seeing
Yeah.
cases in the community is kind of like looking back in time.
Right.
So I mean, of all the places that Delaware County can be, it seems like right now, at least all the places we could be in a situation right now for this moment, we're actually not too bad. I mean, there are measures in place. It isn't here that we know of yet, and the measures are in place before that. That's better than a lot of communities got.
Yes, that's true.
There's a lot of planning and preparation going on behind the scenes that people aren't aware of. So, yeah.
Can you speak at all to that? I know I don't want to, scare people, but I mean,
Well, I mean, the agencies across the county, everybody's reviewing and revising their plans. People that don't have plans are getting plans put into place. There's a lot of communication across sectors as far as like how people can help each other out and making sure that we're communicating information in a timely fashion that helps inform good decisions for other people. And then I think it's important for people to know too that we're not on an island and that we're in close contacts with everybody else. And so I keep saying at our OA meetings, like, we're all in this together. It's not just Norte County, it's not just California, it's not just America. We're all in this together. So we're all kind of learning and doing together. So
Right.
I think the CDC guidance that went out yesterday said like things that every American can do to help prevent the spread. And that's an important message, is like, this isn't just on us and it's not just on the school district. Like, there are actionable items that every single person can do to like contribute to the effort to make a better outcome.
It's really the only thing that can be done because we don't have vaccines, we don't have treatment drugs. This is just old-fashioned stuff that we're supposed to do every year during flu season, and a few extra things added to that. And yeah, if people do it consistently, it's going to make a huge difference.